So, good afternoon, good morning, good evening. Welcome to the ADHD Reframe Project with me, host Emma Craven. And today I am happy to say that I'm joined by Carolyn. So, Carolyn, would you like to just do a little bit of intro about yourself, please?
Yeah, my name's Carolyn Mallon. I'm a doctor of nursing practice, and here in New Hampshire in the US, I prescribe medications and work with clients, specifically a lot of neurodivergent clients.
Wow. And how did you get into the work that you're doing? What was your journey into it?
Well, it was a long circuitous journey from being diagnosed myself previously, and I was not diagnosed until I was 28. But it was such a life-changing experience to be diagnosed, to be treated, that when I went into the field that I'm into, I knew that I would wanna see other people like me that I could help the way that I was helped. And so that's how I got into sort of this subspecialty of working with LGBTQ folks as well as neurodivergent folks. Yeah.
Fascinating. Would you like to talk a little bit about your diagnosis then, if you wouldn't mind, please?
Yeah, of course. Like a lot of people can identify with, I think, especially people who are socialized as women. I think that ADHD is often missed entirely or until later than, it would be with the boys who are diagnosed, who often will have behavior outbursts and more obvious hyperactivity and things. And I think part of the reason is the way we're socialized. Girls are taught from an early age to behave themselves and they're encouraged to use self control in a way that boys are allowed some more freedom to be rough and tumble. So girls get missed. And I think other people would probably also identify with this that, as we know, ADHD runs in families. And if you live in a family where a lot of people are affected by ADHD, I think the symptoms get missed there too, because it's not so obvious. If your parents are like you and your siblings are like you, they might send home a symptom inventory, but your parents are thinking that's not an unusual behavior. That's how I am too, that things don't kind of pop red on a survey of symptoms the way they might if you were in a family that had no ADHD. It would be more obvious. Um, but I wasn't identified as a child at all. And as a result, I carried a lot of internalized shame about my own performance in school. Like a lot of kids, I think I was told I had a lot of potential. But when you don't reach that potential, you hear between the lines that you are lazy. Otherwise, why wouldn't you be meeting that potential? So my diagnosis didn't come for years. And as a result, school was such a difficulty for me that I didn't finish high school. I didn't graduate. It wasn't until I was 28 that I had to support myself. I realized I had to get more of an education. And when I went back to college and it was so hard for me, even as motivated as I was now to succeed, I realized there was a missing piece to understanding the picture. And that's when I was diagnosed. It's
Fascinating.
something I imagine you hear a lot.
Yeah, yeah, there is a lot. Yes, there is I mean, for women, that is a reoccurring theme. Um, and also, for men, it seems that because obviously the symptoms can present as predominantly inattentive or predominantly um, hyperactive. So I know it used to be ADD and then ADHD. And I think even for the men that get missed as children, primarily the most of them have got the inattentive type of ADHD. But for women, yeah, I mean, I was the daydreamer. I was the one that just used to sit and daydream and just think I'm bored. Like, this is
Oh, right.
boring. Yeah, it's not stimulating me at all. And I can look back at my childhood and clearly kind of see that ADHD, um,
Hmm.
like it's glaringly obvious, isn't it? But I
Right.
wasn't diagnosed until I was 43, and that was in 2019. And I think, yes, I love hearing like different women's experiences, because I think it's really important to give each woman the space to use their own voices to talk about their own experiences, because I call it the lost girl generation. Like, we are a generation of women who are currently being diagnosed later in life. And I love that my brain has just decided to stop working. I can't remember what I was going to say now. I'm
Well,
sorry.
to
It's
what
like
you
a
were pointing out, to what you mentioned about boredom, holy smokes, as someone with ADHD, and one of the things I tell people is boredom feels different for ADHD folks. It's painful that if you're not doing something that's intrinsically interesting to you, wrapping your brain around something boring, and not having any dopamine, right? It's painful. I mean, it's just, I can't handle it when I've got nothing interesting for me. And I think the way that showed up in school was that I was good at certain things, right? Showing my potential, and other things I couldn't. I couldn't get myself to learn even with effort. I can remember crying at the dinner table with my mother trying to do math homework, and math was not interesting to me. And I mean,
me
I would
neither.
cry over it. It was horrible. Um, but then, writing stories and things, I did really well. And so I had this very uneven profile where I was in like honors classes for, English and literature. And then I was in remedial math and having to retake remedial math because I just couldn't pass. And I think a lot of people have that uneven, uh, spread of skills or areas that are really tough for them. And it looks to other people who don't get it like you're just lazy or you don't want to do certain things, you're stubborn.
Yeah, selfish. It's one of the
Mm,
things I've been called a lot, selfish. But I'm not a selfish person, but I do think that's because of the way that like, if I'm having a conversation with anyone and they say something that I kind of identify with, then I just kind of, just story tell for the next 12 minutes really fast and don't stop to think and don't stop to breathe. And I think, one of the main things I kind of would like, other late diagnosed women and adults to know is that we're not really we're not selfish. That's how we connect. That's how we can kind of connect with other people, because we need that, we need that connection to kind of, for us to be able to
mhm,
uh just live life, I think. But
yeah.
unfortunately it comes across as selfishness. So
Yeah, I think socially it can be difficult because, when you do get on a topic, it is hard to stop and you get excited about what you're going to say next and you don't want to lose the thought, right? So you interrupt and you go on too long and then it makes you super self-conscious about the way that you present in social circumstances, at least for me. And so it makes me feel awkward and I probably come across that way sometimes because I'm analyzing everything that I say or I don't say or the timing of what I'm saying, and it makes it harder to interact in this natural way that some other people seem to be able to do.
yeah, no, that's not natural for me to. No. Either I think I either communicate with humour that a lot of people don't understand, or I'll say things and I'll be like, I'll go over and over it in my head about a million times and think, why did I say that? And you just said like that, analysing of the conversation. Why did I just? You know, what and because we can be quite intuitive as well. We're able to kind of read energy, people,
Mhm.
body language, stuff. So when you've said something and you're like, oh, and then I would go back and kind of over analyze, and then I'd go back and say, by the way,
Yeah,
the conversation we had 3 years ago that I've thought about almost continuously because I said such and such. Like, I didn't really mean it like that, and the other person's just completely forgotten about it, and
right.
there's no kind of, it's not even on their radar, it's just me that's kind of over analyzing.
Yeah,
So
I can think of examples over the years where I've spoken, said things overshared maybe, or just spoken in a silly way, and you think about it, you agonize about it. And I have to remind myself, like, how many times do I sit there and think about a time somebody else was awkward or overshared? Like, never. And in fact, when people overshare, for me, I feel like that's such a relief. Like, you get to know somebody quicker. And I find that with neurodivergent folks is that, you do overshare and get excited about what you're talking about, but then you feel like you get each other on a level that you don't with somebody who's neurotypical.
Yeah.
Yeah.
Yeah. Yeah. I love that. And I think as well, like, I've remembered now what I was going to say a few minutes ago. Heritability of obviously neurodivergence. I wrote an essay a few months ago around genetics of personality and intelligence, and
Hmm.
I'm studying psychology, and I always kind of, to keep the novelty and the interest, my real world examples, or when I do the discussion, I'll link in ADHD in pretty much anything. Well, there's only two that I couldn't because there were quantitative research methods, which numbers. No, thank you. My brain. I cried. I'm not going to lie. I cried because I just couldn't understand it as an adult. This is
Yeah.
last year. If you, but also just, yeah, and then qualitative, because I was given the data and then I had to analyze it. Yeah, my essay on personality and intelligence, it was like 84, 86% heritability of
Mm,
ADHD. And I was like, what? Because it's like, although I was going to do culture, because we had a choice whether I talked about culture, the culture of personality intelligence, or the genetics, and the genetics was much harder. But actually, I'm glad that I kind of put myself. I don't say I'm glad I put myself through anything, but I think I learned more around,
yeah.
the heritability of ADHD, because that is a huge number, like 84 to 86%.
Right. My mother has ADHD, my brother, my sister, my children, my nieces and nephews. I think it would be easier to try to pick out the few who don't, right?
Yeah.
It is very heritable. And like I said, I think that contributes to it being missed sometimes. Um, yeah, absolutely. And then, if you're lucky enough to get treated, the earlier the better. But when you don't get identified early enough, um, I mean, I can remember when I was diagnosed and then treated, and then how much easier everything got all of a sudden. It was like putting on glasses for the first time and realizing other people saw it this way the whole time. And how unfair did that feel? And the idea of like all these lost opportunities because, I'd been struggling on a level that was unnecessary for all those years, that really threw me in a tailspin for a while. Do you feel like did you identify with that, like, that regret, you know?
Yeah, I think there was grief around it. I think it was sadness, because sometimes I look at it and look back, at my childhood and school, and then things that I've tried to kind of study since I left school, and I have at times looked back and felt really sad, because if I knew then what I knew now, then maybe things would have been very different. But I've had to acknowledge that them feelings, and kind of not let them, like, not let them be my only focus. So I've had to kind of step out of that sadness and out of that grief. And I think now, I use the negative conditioning and all of the negative experiences that I had and all that shame that I carried with me. I use that to keep pushing myself forward.
Mhm.
There are days when things get really hard. Academic writing, my brain is, it's not a natural thing for me to do, but I'm getting better at it. And I think, them bad experiences in my path now, in my past, I use them to keep me going forward, even if it's just half a step, in a day, or a quarter of a step, or one step, whatever. I use that to kind of, to keep pushing me forward.
Yeah, I think it helps me identify with my clients and, have a better understanding of what they're going through if they come to me and we identify ADHD. Um, to such a degree that I wonder how clinicians who don't have ADHD relate and understand on the same level. It feels impossible because if you've never been there, it's just then it becomes a diagnosis with a checklist of things that you're trying to see if they fit, check all the boxes, right? But there's a lot more to ADHD than is described in a diagnostic criteria. So I feel like it really helps. And it helps me connect with my clients, and I like to think that it helps me to better encourage them, and I help them identify maybe accommodations that might help because I've been there. I needed those accommodations. I had accommodations through college once I realized I had ADHD. Um, the irony is that I also had some accommodations in place in high school when I wasn't diagnosed, but it was for emotional problems. They gave me an individualized education program, which is called an IEP here in the States, because I had so much depression and anxiety, which was a direct result of how hard everything was and how everybody around me seemed to be playing on a different level than I was able to play. And it made me feel terrible about myself.
Yeah, of course.
Yeah, but,
Yeah.
I did turn it around once I was diagnosed, and when I started with my associate's degree in nursing, like a 2-year nursing degree, and then I just kept going, but every step of the way, I kept thinking, like, "Can I do this? Am I capable of this too?" And, I just kept going, and it turns out I was capable. I just needed, different supports that I've been offered. Yeah.
I love that. Um, Written a blog very similar to what you've just said there. Like, I
Mhm,
think, obviously for me, tried and tested lots of different studies on lots of different so counseling. I can't think of anything else now. My brain is just a bit it's just not. But there's lots of like courses and stuff in the past that I've started and then not stopped, and then stopped or dropped out. So
mhm,
I was always, as an adult, like the quiet dropout person. So I'd just, go quiet and disappear, and I wouldn't continue. And I think that's because I used to get to a point where I just couldn't kind of understand what was being taught in the way that he was being taught. But obviously then I didn't have the ADHD diagnosis. And it's only since I've had the diagnosis and I've started to I say this, obsessively read and learn as much about it, particularly in women and late diagnosed women. Um, that I kind of better understand myself now. And
mhm.
then within my studies, I've actively advocated, not just for myself, but for other students like me, particularly adults. And I've really tried my hardest to kind of work to study and to do it effectively, so I can reach potential, but also so I don't end up burnt out, because it's really kind of, studying, higher education, any kind of higher level studying it's exhausting. And I used to think, oh, it's just because I've got ADHD, and it's not. It's exhausting for most people. Um, but I just, yeah, I like to hear the differences, like, pre-diagnosis, post-diagnosis, like clearly, both of us are very capable. It's just that we needed to kind of understand what was going on and then put reasonable adjustments in place so then we can, thrive and get the best possible support.
Right. Yeah. Yeah, and I identify with what you're saying about how you can get, obsessively interested in something, and that's that uneven profile again with ADHDers is that you can get so hyper focused and so into something that is, if it's intrinsically interesting, you're getting the dopamine and you're into it, and you can be very accomplished about these topics. It's just you can't like choose what's going to naturally be interesting to you, and so again, it's that thing where they say, "Oh, you have so much potential." Because when I was in school, I could decide I wanted to learn everything there was about Egyptology, and I I could learn a lot. But then I I couldn't seem to focus on Macbeth or certainly math. Um, so it's like you don't always get to choose, but when I do get really interested in something, I can learn a whole lot about it. You can, it's like the world blots out for a while and you just get in the zone.
Yeah. And I think that's why, for me personally, studying psychology is the perfect topic, the perfect thing, because it's around obviously behavior and why we behave in certain ways and stuff. So then it's kind of, I've always been a people person. I always used to say I'm a people watcher. So I
Hmm.
like to watch, behavior, and yeah, it might sound a little bit weird. I'm not a stalker. I don't mean
No,
this in a bad way.
absolutely.
I
I
just mean
think
I like to learn about people and their behavior, and, what makes them tick, as I would put it in non-psychology
Well,
terminology. What
as
makes
a
you tick?
psychiatric provider, I totally understand that.
Yeah.
Absolutely. Um,
Yeah.
but yeah, I mean, like, I think of my hobbies, like a lot, again, of ADHDers, a lot of us have hobbies that you can get obsessively into. I'll like, need to know all the things and have all the accessories or tools I need to get into that hobby. Sadly, after a while, it will lose its shine and then I'll move on to something else. There's a few that stay steady. I've been really into genealogy now for a few years. That's my like obsessive thing and it's research based, right? Like you can get so into it. It's problem solving. Um, but I think that people who don't have ADHD, I sometimes wonder if for them it's actually harder in some ways to like get in the zone and find something that really, really enthralls them and get as obsessed on the same level because you can learn and accomplish with so much if you really, really drill down into something, which seems to be an ADHD trait, that level of hyper focus. I see it with a lot of my clients too, that they have
Yeah.
very specific, maybe niche hobbies or interests. It allows us to bond about things.
Yeah. I was just sitting here thinking, yes, there's many things that I've needed everything to do, and then after a few weeks or a few months, I've got bored and moved on to
Hmm.
the next thing.
Right.
Um,
Yeah.
so yeah, and I do think that to non-ADHD people, we are walking, talking contradictions, because, for example, we say that I struggle with time blindness,
Mm,
always late, or we can't work out the amount of time that something is going to take us to complete. But if anyone's late or they're longer completing whatever they're doing, we're sitting there like impatiently, like, come on, we need, but, but,
yeah.
but if they're waiting for us, it's like, I'll be there in 5 minutes or whatever. And I do think, like yeah, we are walking, talking contradictions.
Right. I think my time blindness has resulted in like time hypervigilance. I'm now so worried about being late or forgetting things because I historically always did. Um, I wonder sometimes how I even got by before because I didn't used to use a calendar. I would just expect to remember things. And I don't know if other people can remember things. I certainly can't. So everything has to be on my calendar. Everything has to be set up so that it'll give me phone notifications an hour before, 10 minutes before. And even still, I will sometimes miss things, but
Yeah.
it's totally necessary for me. And now, as a result, I'm like early for everything because I'm so afraid of being rude and just forgetting. But it's not natural for my brain to be able to remember and like hold information that's sort of dull, like scheduling. Yeah.
Yeah. No, exactly the same. I have 1, 2, 3 calendars. They're all connected, and I get notifications on the laptop, notifications on my phone, and
Hmm.
I just try and be as vigilant as I can, which sometimes is not always, doesn't always work, because obviously we can get distracted, and then,
Hmm.
I've got distracted by something shiny, or I'm doing something related to ADHD, or I'm just, doing something, and then I'm like, oh my God, I'm meant to have been meeting some such and such at 4 o'clock and it's now 10 past and I haven't even left yet. And it's like, so yeah, I do. And I think that is becoming a reoccurring theme, but I love when guests like yourself come on and they say, yeah, this is, obviously time blindness, or, that kind of shame spiral that we can get into if we're late around timings and stuff.
Hmm.
I think it's good for me because it teaches me that I need to be as vigilant as, other people are, or not. No, I don't. I think I need to do it to the best of my ability for myself, not for other people. But I've noticed that if I say to someone out loud, so say I was meeting you at 4 o'clock this afternoon, it doesn't matter whether it's my time or your time because we're obviously in two different countries. But if like say I have to leave the house and meet up with someone, if I actually say to them, right, okay, I'll see you at 4 p.m. this afternoon, I won't be late, then for whatever weird reason that then triggers, because then I'm accountable to that person, aren't I? So,
Hmm.
I need the added accountability. So it's weird by me just verbalizing that and saying, I'll see you, I won't be late. It then gives me that added kind of train of thought around, what time do you need to leave? How long is it going to take me to get there?
Hmm.
And it's like that additional kind of accountability that I really just, and I don't know how or why that works like that, but it just
Yeah.
does.
Yeah. It always amazes me that people who are neurotypical and perhaps some people with ADHD, but not me, can remember like names, and I will recognize faces, but I can't tell you somebody's name half the time. And it's like I just go blank, even if I know the person well. I was introducing somebody the other day and I know them both well. And I went totally blank. I couldn't remember this guy, Dave, his name, totally gone. And of course, he's got to be a little offended, right? That I can't recall his name. But sometimes, even especially when I'm trying really hard to remember something, it's like I get this anxiety block that stops me from thinking, and it's embarrassing. Um, my husband, who has not got ADHD, is so good at it. Everywhere we go, he remembers everybody's names and how he knows them, and he's just he's a natural with that stuff. I really wish I was, especially if I see somebody out of context, right? Like in an environment that I'm not used to seeing them in. Yeah, good luck.
What's his name? Oh, Thingy Majiggy. Uh,
Right.
I'd be like,
Yeah.
oh.
When I go to social things, sometimes I wish I had like flashcards. Like I should review them before I go.
Or everyone should walk around with a little name badge on, or one of them
Right.
post-it notes on their head so you know who, oh yeah, that's Dave over there, hi
That would be
Dave.
so much easier.
Yeah, a little name tags, maybe not
Yeah.
something on their head. I don't know why I thought of something on their head, but I was like, a little name tag, yeah.
Yep.
Yeah.
Either
Sorry,
or
that's
would be
just,
helpful.
yeah, yeah. Or you just say to everyone, I can't, I normally just say, I'm sorry, but for the life of me, I can't remember your name. I know I've known you for over 20 years, but I'm sorry. What was your
My
name again?
husband and I have this little trick, like if we're in a social situation or we're just walking down the street, if I don't introduce him to whoever that person is after a few seconds, he will say, "Hey, my name's Simon. What's your name?" So that it's not apparent that I have no idea who this person is. So it works really well. And I'm sorry to any of my friends and acquaintances who may watch this and realize now that that's because I don't know who they are. But it works well. It's that trick.
Yeah. And my partner does that with the times as well. He'll give me like a little countdown. So it was a bit frustrating to start with, but now it's like he says to me, right, we need to leave in 20 minutes, 15
Right.
minutes, 10, 5, now.
Yeah.
And the
I'm
5
like
minutes
that.
is fun.
If I get into an activity that I'm really into, I like shifting gears is very difficult for me. It's like, again, like boredom is painful, like pulling my attention from one thing that I'm really hooked into and then like paying attention to something else. It feels like a really difficult transition. Um, and you have to like give me a heads up. My husband has to tell me, yeah, we're going to leave in 10 minutes. Like, extricate yourself from your hobby.
Yeah. Yeah. Yeah, yeah, that's nice though as well. And I do struggle pronouncing words, some words, and my other
Hmm.
half, bless him, he says them out loud, and I try and pronounce it, and he's like, he just laughs because it's hilarious, and it's almost like I don't know what goes on in my brain where I can't pronounce certain sounds or certain words, but yeah, thank goodness for patient men, let's say.
Right, right. Yeah. I think it's interesting with a lot of people that I've known that are very intelligent but will get a word wrong. I'm convinced it's because they're used to just reading the word. Like, if you have read it, you're very familiar with what the word means and how it's used in context, but you don't always know how it's pronounced. I mean, I can think of many words over the years that I got totally wrong until somebody corrected me, but it's because I knew them from reading only.
Yeah. Yeah. I listen to everything on audio now. So particularly when I'm studying, like some academic um writing is very dull.
Yeah.
Sorry to academics. I'm sorry to you high level academics that, have been in your field for years, but some of the stuff is very dull. It's written in a dull
Hmm.
way. So I've got an app on my phone called Speechify,
Hmm.
and you can choose a different voice. It and Snoop Dogg's on there, and there's quite
Hmm.
a few other celebrities that are on there, but
That's
I've
hilarious.
just honestly getting Snoop Dogg
Yeah.
to read out, like, a kind of biological neurosciencey type, research paper to make it just a little bit interesting is
Hmm.
hilarious. So yeah, it's
Yeah.
just because I can't read and take in a lot of text, even,
Yeah.
in a book or on a laptop. I just can't do it. So I just put everything on audio, and I just
Yeah.
listen,
I
and it's
did that
just,
in school. It was really helpful in grad school. I used an app, I don't know what it was called, but it would read whatever ebook, whatever textbook or article that I was trying to learn and absorb. And I found that way easier because I could do something else while listening. And it's like it irons in all that information because I feel like it's easier if you're not so bored and if you keep your hands busy. I did a lot of sewing during grad school. It was the pandemic. So I had my sewing machine in my living room and I would listen to lectures and textbook chapters and just sew. And I swear I learned that information better than anything with just sitting there reading in a highlighter, for sure.
yeah. I think as well, someone suggested it to me a couple of years ago, like, get up and move around and listen.
Hmm.
Distract yourself. And I sat and thought for a long time, surely if I'm distracted doing something else, then I'm not going to be able to really listen and take in what's being said. But trust me, it works. And I wish I could remember the person that suggested it to me, because if I could remember, then I'd go back and thank them. But it's like, and I've told my friends, I've told people I've met through my university, I've told staff, and they're like, "Yeah, I can tell that they're not saying it out loud, but they're like, surely that's not." And trust me, it works. Like,
Yeah.
by not even paying it a lot of attention to what's being said, just your brain is still taking in the information.
Yeah, I
So
did something like that in nursing school. I would make my notes from lectures and the reading, but just rereading notes wasn't helpful. So I would record myself reading all my notes and then I would listen to it on walks, driving around in my car, anything like being at the park while the kids played. But if I was less bored and antsy, it was easier for the information to get through. So that makes a lot of sense to me.
yeah, yeah. I mean, if the person who suggested this to me is listening by any chance, then please do reach out and let me know. But I don't. I think it was a lady on LinkedIn.
Yeah,
I
it's a
think she
good tip.
just yeah, and it's just fascinating, like little kind of hacks or little tips like that. I think, oh, like, just 'cause I'm very chaotic, I'm very messy, I'm noisy, I'm just personify the ADHD kind of, too oversensitive to this, to that, to that, to this, to this. Um, and I used to kind of, I've spent many years trying not to be like that, and now I can't be bothered to do that because it's exhausting. So I just, turn up as myself, and uh, um, sometimes people don't really like my chaotic, noisy, messy self, and so I think I just, at the end of last year, or the beginning, I can't remember. I just decided I wasn't going to mask anymore. I just can't be bothered. Like masking it's exhausting. Have you had any
It is
experiences with masking
exhausting.
and not masking?
Yeah, I feel like in a lot of those social situations, I'm trying to pull off this character almost, like of somebody who's got it together. It's a relief when you do encounter someone else in a social situation who is similar, right? You can read the room a little and identify people who might be neurodivergent once you start talking to them. And, and that is so much easier. And other people might find them exhausting. But for me, we're meeting on the same level. And so, it's such a relief to be able to just like be myself and talk over each other and share stories. And it's a lot harder when you're trying to like prove to other people that you're normal. That's exhausting. Yeah. And I
Yeah,
feel like professionally, I have to do that to an extent. But again, because I work with so many neurodivergent folks, I think probably a lot of them find it a relief to not be stuck in front of some stodgy old clinician who doesn't really get it and is very formal. And I'm not that way. I keep lots of fidgets around and fidget and sit funny in my seat. And I feel free to do that because I think it's actually validating for the clients that I work with to see that that's totally normal. It's normal if you're neurodivergent.
yeah.
Yeah.
And that seems to be like a reoccurring theme of the podcast in the last few weeks seems to be that, just enabling people to turn up as themselves and just be who they are and how they are. And I don't even know. People say, "How do you do it?" And I'm like, I don't know. I'm just me. I don't know how I do it. It's just something that I can do, and I don't know how or why. It just is what it is, and I think that's really empowering to hear, you saying that you turn up as yourself, even obviously to a point you have to be, I call it newsreader Emma. It's the sensible one.
Yeah.
And I'm just saying, no, I can't keep that mask on for long. But it is
Yeah.
really nice to hear that you do that within your work because I do think it's the most empowering thing when you're looking at someone, someone comes to you for support or they come to you for, your clients come to you for whatever. I have always for me personally, like when I found someone within my university that's also got ADHD, like a staff member, and they can explain things to me in a way that I actually understand, like you do naturally kind of feel more comfortable with them
Yeah.
and more safe to be you.
Yeah. One of the things that I love about sort of like being transparent about my journey is that it's other people having been transparent about their journey with ADHD or academic difficulties that was my inspiration and gave me hope. I remember taking a class, a speech class when I was younger, and um, one of the people I met in that class, a professor, told me that he had not finished high school and that he had gone back later and now he was a professor, he had a doctorate. And I remember thinking, wait, that's allowed? I can go back and become a doctor of something? That's crazy. But you don't even realize that you've internalized that kind of message until you encounter somebody who says, no, that's not true. And they show that they were able to achieve something. And then you recognize that message you'd been carrying around that was completely inaccurate. So I think it's
Yeah.
really important to share that information, especially if you are in a position of having accomplished things, despite or also in because of the differences and how you learn and how you present yourself and how you interpret and interact with the world. Yeah.
Yeah. Yeah. And that is one of the things that I love hearing about from the guests as well. Like, because I think that is, it just kind of, because I think that, not diagnosed to like pre-diagnosis and then post-diagnosis, I think that, I had to learn about my ADHD symptoms and I had to learn what certain things meant. But then since then, like yourself, I've gone back to school, so to speak. It's not school, it's university. But the difference now is that I actually reach out for support. I will tell someone if I'm struggling, if I don't understand something, I have reasonable adjustments in place. Um, and I'm so blessed because the support at my university is amazing. But not only that is you've got staff that will actively go out of their way to kind of sit with you, and will sometimes explain different concepts to me, or I'll ask the same question and they rephrase the answer over and over again until I kind of understand it. And I really think that, like yourself, being going back to education and almost starting from scratch as an adult, or finishing, going through high school or college, or I don't know what it's called in America. But I think it's really important, just, because we are actually more capable than we've ever given ourselves credit for. And it's only when we start doing it as a diagnosed ADHD person that we actually realize that it's not our fault. We're
Hmm.
different. We learn differently. We don't fit the one size fits all. We're not going to follow a straight path. We're going to go off on a million tangents and, but actually, like, just to be able to be empowered or empower other people, just be happy, or to try and be comfortable with who they are and how they are. And then they can advocate for themselves is, if I can
Hmm.
just give one person that in the future, then I'd be happy, because it's really
Yeah,
important, isn't it? It's a really
it is.
important kind
And a
of
lot of
if
people underutilize their resources, I think, or don't realize they're there. When I went back to college when I was 28, well, I say go back to, I hadn't been there and I decided I was going to go back to the schooling environment, but I was so insecure about it and so nervous. And even knowing, once I knew that I had ADHD and that explained some things, I still needed more support, but I went into the counseling office on my college campus and I just said to somebody there, "Hey, I'm struggling as a person returning to school and I'm very insecure about it." And at the time, I was a single mother and there were just a lot of balls I was juggling. And I told them that, and I feel like that was such a good decision because they said, "Okay, well, let's meet once a month." And it wasn't for therapy. It was just a check in, like, how is it going? Are there classes you're struggling in? Like, how's it going at home with the kids? Like, any resources you need? And that made a big difference because it gave me this like place to touch base and know that there was somebody there who was available if I needed extra support or help. And I took advantage of the tutoring on our campus. And I think a lot of people either don't realize those services are available or they're like shy about accessing them. But I can't recommend enough, like, what a difference it makes to let other people know if you're having a hard time with something and asking for that extra level of support. Super important.
yeah, yeah. And it is it and it's obviously very nerve-wracking, because as you were, saying how you felt when you went back to, is it college that you went back to?
Yeah, we call it college for all of the university, that whole
Okay.
level. We just refer to it as college. Yeah.
College. Okay. Okay.
Yeah.
Yeah, when you started your education journey again. Oh, that was very newsreader, Emma. Yeah, when you went back to education and college and stuff, I kind of, I remember and I'd already been diagnosed, but I remember starting, and even like before I started, I felt very, very, very inadequate. And like, the reoccurring thought was, well, you've tried this and you've tried that, and, you've done this and you've done that. And then you just went quiet and didn't understand and dropped out rather than reaching out for help. So I think the inadequacy that I felt at the beginning was so overwhelming. But like
Mhm.
you, and I don't even really kind of know where it came from, but I just almost subconsciously was like, right, okay. I got to the second module because I study 100% online, so it's all virtual. So I got to the second module, which unfortunately was Introduction to Research Methods and Quantitative Research. Numbers, like yourself,
Yeah.
numbers just are boring. My brain
Mhm.
just wants to switch off. But I got to that second module, um, and I just felt so inadequate. And luckily, one of the lecturers on that module was just like, reach out to the academic skills, reach out to um, inclusion team or wellbeing team, reach out, get help, like, and then they also allowed me to have like up to an hour a week one-to-one tutorial
Yeah.
during the module with someone that was teaching
That's
the
great.
subject. So and that's now one of my reasonable adjustments. Like, I've got that solidly in place, where
Yeah.
they have to be accommodated in that way. But I think, like, I don't know, I think it was just, I think what drove me to do that was fear of failure again.
Yeah.
But, it was obviously turned into this amazing thing, because it's like, just so if you are struggling at school or at work or in education, then please, find out where your support systems are and reach out, because,
Yeah.
just by us two having this conversation, clearly, we kind of understand that deeper level of feeling that level of inadequacy, but reaching out and doing something differently.
Yeah.
Um,
I had tutoring for every single math class for every level of education that I've done, as an adult. I've had tutoring for statistics, for algebra, for biostats in grad school. I've always used a tutor, and I have no shame about that whatsoever. It's like the schools often offer that for free, and if you're not utilizing it and you're struggling, know that that's there and take advantage of it, because boy, it made a difference. And I even became good friends with one of my tutors, probably because I cried in front of him a few times. But you bond with people that are helping you sometimes. But the point is that I don't think I would have made it through those classes without tutoring, and there's no shame in that.
no, I love that. That's just, yeah, yeah, statistics, a quantitative, just doesn't really, like a multiple linear regression and over 2 by 2. I'm just like, what? I'm not gonna lie. I cried during the second module, which was
Yeah.
the introduction, and I cried through the quantitative. But I did exactly like you. I had support in place, and I had an hour each week, and the lecturer was just fantastic. Like, she just allowed me to just be overwhelmed and cry, but also said to me, okay, so specifically, what is it that you're struggling with? And then, she would explain things to me in so many different ways. But one of the main things that she did is she showed me. So we had a specific software that we used, Jamovi. I don't know if you ever heard of it, but
Mm-mm.
again, and my brain is just, it doesn't work. I just don't. Um, but she actually, like, what I most of the time need is actually someone to practically, so study skills sessions, show me how to upload the data, show me like step by step how to do click all the things that I need to within the software to be able to then get the results. And then what they do is they record the sessions, and then I go away and just practice over and over and over again. And it's only through the repetition that I'm able to remember the
Mhm.
basics. But yeah, and I think for any student, for any person, whether you're an adult or a child, you need to just understand that there is support out there. Even just, writing a paragraph or paraphrasing, or, how do you synthesize your argument? Like, I need to, I need that practical kind of demonstration before I can then go off and do something on my own. But then you've got the video recording there, so if you forget, you can go back to it.
Mhm.
Um, and I think one of the beauties of online degrees is that everything's recorded. So the lectures are recorded, so you can go back time and time again. You don't
Yeah.
have to just, write a long-winded email, which I hate doing. Can you help me with such and such? Because they've covered it in the lesson, so you can go back to the lecture and it's all
Mhm.
there. And yeah,
Yeah, absolutely, and there's so many tools now, even since I was in grad school, where you can get, like, the transcript from a video, whether it was a lecture or a YouTube video. You can have AI summarize it, quiz you, like, for your understanding, rephrase things. I mean, the tools that are available these days, it's amazing. I wish they were there when I was in grad school, but, um, again, like, because it's new technology, new tools, not everybody knows about it, but it can make things easier, that's for sure.
yeah, of course. Yeah. And I do like that. I have got assisted tech software that is given to me through so in the UK we have something called disabled students allowance. So you get a certain amount of allowance. I don't know if you've heard of it, but you get access to, they call it non-medical help. So you get access to one study skills tutor appointment and one mentor appointment a week. But
That's amazing.
they also give you assisted tech as well. Because I there's certain things, obviously, with the like listening to everything on audio, but I love a mind map. For me,
Mhm,
a mind map is just, it's visual, it's, I can create it to be really colourful, and then I can add all the information in, and then with the software that I've got, which is called Mind View, I can export all of the information in the mind map into a Word document, and then
very cool.
that's kind of like the framework for, the essay or whatever it is, or the research paper that I have to write and stuff. So I think, yeah, and just having something that can, because I know lots of students, and I used to do it at the beginning, like read the whole research paper. You don't need to read the whole thing and understand it. You only need to take bits of information to be able to obviously synthesize your argument, don't you? So it's
Mhm,
like learning the tips and tricks on how you can do these things that take less time and energy is really
mhm.
important, isn't it?
Yeah, and even, m I was gonna say despite of, but I think because of my ADHD, uh, when I found ways to, like, hack learning, I felt like I had a better understanding of it than a lot of the other students. I for my classes in grad school, I color coded all of the neurotransmitters as I was learning them. So every time I would make a flashcard or write notes, if it was about a certain neurotransmitter, I used the exact same color every time. And after a while, you make these links in your head. I still see it in those funny colors, but you iron in that knowledge so much more effectively. And I think that the neurodivergent mind finding these little ways to remember stuff, you actually can iron that in better than a lot of students who just do the reading. So I feel like you got to use those tools, find what works for your brain and your learning style. Mm.
Yeah. And I think as well, empower yourself by advocating and just say, I'm sorry, but that doesn't work for me because my brain is different to maybe the person that's teaching or the lecturer, or even the way that something is written. Like I say regularly, I think in ADHD, I talk in ADHD, and I write in ADHD. And there's like, you can clearly see it because even when I'm writing some essays and stuff, I'll go off on little tangents, and then when I'm reading it through or listening, because I listen to it before it's submitted
Mhm.
properly, and the before the deadline, I listen to it. So I will actually listen to what I've written and try and make sure that it kind of flows like it's
Yeah.
meant to. And don't get me wrong, it's not a foolproof process because, I think, well, yeah, that's great. Like, it really makes sense to me. And then the feedback is like, yeah, you need to learn to synthesize your arguments because, and I'm like, hold on a minute, I've got ADHD. That made full sense. That made perfect sense to me the way that I wrote, the way that I wrote it, or the way that I understood it. And it's like,
Yeah.
thankfully that doesn't really show in the grades. Um, but it's just the two things are very, very different. And I always find that like I can pinpoint specific lecturers that even before they say that they're diagnosed with ADHD, you can clearly see it. And
Hmm.
it's, you kind of pick up on the ADHD radar stuff. But yeah, I think empowering anyone just to kind of, advocate for themselves is yeah, it's really important.
Hmm. Definitely.
So if any of our listeners do need support and you are in America, then please, please, please do reach out to Carolyn because clearly she's doing amazing, absolutely amazing work. And well done. You've come from like similar to me. You were a bit younger when you started again, but I really admire the fact that you've gone back to education and you're where you are now. So yeah, girl power.
Well, yeah, absolutely. Thank you. It was, you know, one of my favorite phrases is, it can be hard and it can be scary, but just do it anyway. And I think that that's really helped me every step of the way is to recognize that me feeling frightened or anxious about something doesn't mean that I shouldn't do it. It just means that I'm having a natural response to something that isn't hasn't always been easy for me. But I used to have that written on my refrigerator. Like, be scared, but do it anyway.
Yeah. 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 And my brain is just gone again. It's just decided I call them a
It does
brain
that,
fart.
doesn't it? Yeah.
Yeah, it's like if something really kind of I was gonna say respond to that, but it's just gone anyway. Um, but yeah, I mean, absolutely thoroughly enjoyed talking to you. I know
Thank
it's the
you. You
morning
as
for you
well.
and it's the afternoon for me, so yeah, it's very, very strange that how many hours behind. It's 3 o'clock now here, so
Yeah,
is it
it's 10 a.m.
10? Okay. I can't even work that. I'm glad when I emailed you yesterday, I'm glad you didn't ask me for the time difference because I have to hold my hand up. And there's been ladies that I've like reached out to before I had the booking system, and they've said, "Oh yeah, what, like 5, 9, 5, whenever PM, AM, like PST," and I'm like, I don't even know what PST is, so
Yeah.
I have to Google it, and then I'm like,
Yep.
"Oh, okay, I get that," and then
Good
I'm
old
like,
Google.
yeah, and then I'm just like, "Oh, I'm sorry, but I don't do time. I can't work it out. Even with Google, it's like my brain can't comprehend time differences."
Yeah.
But now everyone that's around me automatically will say, "So yes, this is 2 p.m. UK time," and I'm like, "Yes, thank you." So I know I've got to be there by 2 p.m. my time.
Right.
It's another hack. So anyway, Carolyn, what an absolute pleasure to talk to you. I love talking about studying. I like talking about ADHD. Um, but yeah, to the listeners, if you're struggling with anything, then please reach out to Carolyn. She's doing amazing work. And is there any kind of last hint or tip that you'd like to give the listeners? Like one thing that you wish you'd known many, many years ago?
Uh, I mean, I guess what I wish I had known is about how effective and powerful it can be to recognize that if you're struggling, there's no shame in it. And then, like we've discussed throughout this whole episode, is just asking what the resources are, asking for what kind of help you can get, because we don't always know. And, you can find techniques or supports that are going to make a big difference, accommodations, and healthcare providers like myself can recommend them, can write letters to the school to make sure that you're going to get the support you need. So I would say just no shame in finding out what help you can get.
Beautifully said. Thank you very much, Carolyn. So, thank you to our listeners. I can't remember which episode this is now. However, yeah, it's just, there's little details like that. My little brain is just like, I don't know. I think it might be 14 or 15 now. I can't remember. But it has been an absolute pleasure. And thank you for your time. And thank you to the listeners. Take care. Bye bye for now.